Hi, Jokers. Thanks for watching this episode of Jokers Physiotherapy. So, today I wanted to talk about jaw pain, grinding, and mouth guard. So, we know when we go to the dentist and they discover that when your teeth are worn, they will tell you, oh, you've been grinding or clenching, and that's been so wearing down your teeth, risking cracking your tooth or teeth. Please consider wearing the oral splint. Well, definitely the research has, this is a systematic review that I have seen, or a number of researches bundled up together and get the result. It's suggesting, that's what the systematic review is suggesting that oral splint has no place for jaw pain improvement or grinding. So they can continue to persist. Obviously, it may have some impact in protecting your teeth, but it won't have any effect on reducing the jaw pain or stopping the grinding. It will stop the effect of grinding, which is possibly grinding down the teeth or eventually cracking your tooth, but it doesn't stop those original problems, because if the grinding is the problem causing jaw to dysfunction and consequently cause jaw pain, unless splint does stop the grinding, it won't change the pain in the jaw. So the results speak for itself. It kind of does make sense to me as a physiotherapist who specializes in treating jaw problems, that the actual oral splint may improve. It doesn't say in the research, may improve or stop the cracking from happening, but it still doesn't help the jaw pain or grinding, which is the original problem that's causing the jaw pain in the first place. So if you're considering wearing the oral splint to help improve the jaw pain, it'd be great if it does help you, fantastic. But from the research standpoint, it still doesn't solve why you were grinding in the first place. For what I know, the reason for grinding is multiple. It could be number of things, number of factors coexisting within yourself or within the factors that are going on. One, poor posturing. Two, obviously stress. Often poor posturing and stress can coexist, because a lot of us do desk work. And if you're in a poor posture, when you have a deadline or you have some back and forth between the colleagues, you name it. Obviously, if your head is forward, it can make you clench and grind more, and you kind of have the same posture in your sleep, so you grind again in your sleep. Second, from the clenching, grinding, that can make your jaw to have so much stress through the jaw joint, it can make your disc to displace, or displace with reduction, meaning it goes back in. With displace without reduction means the disc doesn't come back in. They all cause some level of symptom in your cheeks, maybe your jaw joint, maybe coexisting with a headache and migraine, tinnitus, that is the ringing in the ear, or feels like water is in the ear, earache, dizziness, you name it. It could have some multiple symptoms that are related to these symptoms with your jaw. And also, if you have any sinus issues, namely sinus nasal passage narrowing, which prompts you to breathe through your mouth, and that means your tongue will stay down on the floor of your mouth rather than the top, and with your teeth apart, lips together, breathing in through your nose, you have to lower your tongue down so you can take the air in through your mouth, which dries your mouth, and dry mouth can drive or prompt more clenching and grinding. And also, tongue being on the floor of your mouth, it can push the bottom jaw forward, which then brings the bottom teeth closer to the top teeth. Again, combining with a poor posture, it's just a perpetual loop that just keeps going. So if you have these factors, unless you remove or get rid of or improve these factors, things can continue. Things as in the grinding can continue, therefore pain may persist, for which you're prescribed the splint. Does that make sense? So it's a perpetual loop, but it's not cutting through the cause of the problem in the first place. The fourth one, and it's rare, but it could be your reflux, where you are getting acid reflux through your esophagus, and high acidity can, the vapor form even, can prompt more clenching and grinding, especially in your sleep because you're lying flat, for which you may prop up your head by putting more pillows, which then compromises your head posture, then you may clench as well. So it's just a perpetual loop. So if it's an acid reflux problem, obviously, then that needs a medical doctors to assess and treat or find out why you're getting high acidity. But yes, they're the factors that I know can drive your grinding and therefore persistent jaw pain. So if you want to get to the bottom of why the jaw pain and the grinding is persisting, for which you're wearing splint for years and years, well, you've got to really seek help from a professional such as a physiotherapist who specialize in treating jaw problems, or other professionals. Please see someone who deals with the body in a mechanical manner without using some possibly external devices such as splint or injections or any other stuff, other than your own body and the knowledge and how to move your body, how to use your body in the right way so that your symptoms don't have to continue persisting. Okay, thank you for watching this episode of Joker's Physiotherapy. If you like these videos, please subscribe, or please give us some thumbs up for this video, or please leave us some comments in the comment section below, and let's get chatting, and happy rehab. Cheers.